Hello my health warriors. Welcome back to our channel drhealthfactory. In this video, we will discuss about hypertension, which is commonly known as high blood pressure. So without wasting our time, let's begin with the topic. Hypertension. Hyper means high and the word tension is the pressure of blood on the walls on blood vessels. Hypertension is medically defined as the elevation of diastolic pressure more than 89 mm of mercury or systolic pressure more than 139 mm of mercury. In other words, hypertension is a condition in which blood pressure in the body increases above the normal range of 140/90 mmHg. You might have heard your parents, grandparents, or other people saying about they have blood pressure, but do you really have knowledge about blood pressure? What is blood pressure in medical terms? Blood pressure is a natural physiological lateral pressure on the blood vessels generated by a column of blood through which it flows. The normal value of blood pressure in the human body is 140/90 mmHg. Stages of high blood pressure. Based on the range of blood pressure, hypertension can be divided into 4 stages, which are as follows. 1. Normal stage. The systolic and diastolic blood pressures should be below 120 mm of mercury and 80 mm of mercury, respectively, for the blood pressure to be considered normal. 2. Mild stage prehypertension. When a person has prehypertension or mild stage, their diastolic and systolic blood pressure ranges are 80 to 89 mm of mercury and 120 to 139 mm of mercury, respectively. 3. Stage 1, moderate hypertension. The patient has stage 1 hypertension, with a range of 140 to 159 mm of mercury for the systolic and 90 to 99 mm of mercury for the diastolic blood pressure. 4. Stage 2, severe hypertension. Stage 2 hypertension poses a major health risk. The diastolic blood pressure is equal to or above 100 mm of mercury, and the systolic blood pressure is equal to or more than 160 mm of mercury, making the blood pressure range quite high. The blood pressure of an adult human is typically 140/90 mmHg. Hypertension is caused due to abnormal functions of some of the organ systems. 1. Caused due to neurological cases like acute stress, increased intracranial pressure, and psychogenic conditions. 2. Endocrine causes are hypothyroidism, Cushing's syndrome, hyperthyroidism, and adrenal tumor, pheochromocytoma. 3. Renal causes are long-term kidney infections, renal artery stenosis, acute glomerulonephritis, polycystic kidney disease, and renin-producing tumor. 4. Respiratory causes are obstructive sleep apnea, acute respiratory failure, etc. Do you know what are the symptoms of hypertension? Well, here are a few signs and symptoms of high blood pressure. Fatigue. Vision problems. Irregular heartbeat. Severe headache. Palpitations in your neck, chest, or ear. Chest pain. In some cases, blood and urine. Difficulty in breathing. Sweating. Dizziness. Aggressive behavior. Facial flushing. Nervousness, etc. Do you want to know few natural remedies to reduce your blood pressure? If yes, here are some of the tips to maintain your pressure. Avoid consumption of excess alcohol. Decrease salt and salted food intake. Reduce your stress and improve your mental health. Don't be obese, reduce your body weight. Avoid food rich in sodium. Avoid tobacco consumption and smoking. Focus on regular exercise. Reduce intake of sugar and carbohydrates. Follow yoga and meditation. Consume food rich in potassium. Have proper sleep, that is at least 6 to 8 hours of sleep. Walk for 15 to 20 minutes after every meal. Consume proteinous food. Avoid eating processed food. Say no to caffeine. Prepare a tight schedule for eating food and follow it strictly. Lastly, we will suggest you to inhale deeply, find a peaceful time, and visualize a calm setting. Shut your eyes and visualize a peaceful environment. With every breath out, release tension. If you are new to our channel Drhealthfactory, do subscribe and press the bell icon.